Good afternoon, everyone. Today's session is going to be really helpful and is led by Dr. Chetnanand Jha. He is going to talk about newborn care. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Yeah, okay. So, good afternoon, everybody. Thank you very much for inviting me over here to tell you something about, say, newborn care. So, primarily, uh, for a new in a newborn care, okay, we need to follow few things that is very important and that is very simple as well. So, breastfeeding is most important thing that needs to be taken care of. Exclusive breastfeeding, what we recommend for first 6 months, and that is say important as it prevents infection, and besides infection, it provides proper nutrition to the baby. And as early as within first 1 hour, we have to start with say breastfeeding. Regarding breastfeeding, what mothers should understand, that mothers should be motivated for breastfeeding, and latching, proper positioning, these things are very important for initiating breastfeeding. And it's not that breast milk will come first and then baby will start feeding. So first we have to put baby to mother's breast in a proper position. Can take help from say lactation consultant. Okay, and so we have to start breastfeeding within first 1 hour of life. Okay, and start continuing with that every 2 hourly or 3 hourly. So demand feeding is ideal. Hello, hello. So demand feeding is ideal, but we need to understand one thing, that baby they do sleep for 7 to 8 hours. So hello. So, so what I was talking about is exclusive breastfeeding is most important thing that needs to be taken care of primarily for first 6 months, and initiating breastfeeding in the initial hours is very important. So normal for normal deliveries, mother with say normal deliveries, Hannah, they initial breastfeeding is very is say easy to say establish in even in LSCS. We have to start with say breastfeeding as early as say 1 hour, and establishing breastfeeding first in first 3 to 4 days is very important. That will help in preventing infection. Now, after breastfeeding, one should be very important thing is say temperature maintenance. So temperature maintenance, especially for preterm babies and even for term babies, is very important. So what we need to understand is temperature. It helps in the proper growth of the baby, and if and whenever mothers feed, breastfeed, so she should touch baby's hand and feet by the back of the hand, and it should be warm to touch. If it is cold to touch, that means baby is in cold stress, and we need to increase the temperature of the room. We need to put mittens and socks and cap, as well as cover the baby properly. So maintaining temperature is very important. Regarding uh, regarding cord care and skin care, this is important is cord should be kept clean and dry. Nothing should be applied on the cord, and it shouldn't be soiled with stool or urine. While fastening that diaper, we have to take extra care that cord should be diaper should be below the cord. so that it shouldn't be soiled with urine or stool. Okay, once cord is shrivel off completely after the 7 to 10 days, then we can clean it with say sanitizer once 0.75% an alcohol based sanitizer. And while doing that, at times few drops of blood can come out, so you have to press it with say dry cotton and it will stop. So that is not a big thing. Then regarding other care of skin, we have to be very particular that nothing should be applied on the skin initially. You can sponge bath your baby till cord fall off, and after that you can start with bathing. So in initial 1 month, no cosmetic product is recommended. Nothing should be applied. You can start oiling once you start bathing. Okay, that is after say 7 to 10 days. And in oiling, you can use say coconut oil, olive oil, yeah, or almond oil. Okay, and you need to understand one thing regarding say danger signs for a child is, so baby should maintain temperature on its own. Then there should not be any difficulty in breathing. There should not be any fever. Rashes, neonatal rashes in initial days can occur. Okay, that is not a big thing. Okay, but if it is say if it is neonatal rash is very say intense or more, you can take say your pediatrician help. So mostly feeding, temperature maintenance, and you should know the adequacy of feeding. Regarding adequacy of feeding, one should understand that baby should pass urine at least 6 to 8 times in 24 hours. That is true after say 3 to 4 days. Before that, even 4 5 times urine is quite okay. Stool frequency is quite erratic. So at times baby can pass the stool say after each feed, that is 10 to 12 times in a day is normal, or once in 4 5 days is also normal. So nothing needs to be done for that. So these things are normal routine thing that we need to understand that this is good or this is bad for your baby. So infection prevention is most important thing in initial days. So any viral infection can lead to very dangerous outcome, can very severe for your child. So you have to be very particular regarding say viral infections or other infections. So properly you have to hand wash before touching your baby. So all these things are normal routine care. Vaccinations, both vaccinations should be done as early as possible. Probably within, before shifting baby to mother side. Vitamin K injections needs to be given. Okay, that is a routine thing in assisted deliveries. And screening a certain metabolic diseases, and screening should be done after say 48 hours of life. So that needs to be done, and the reports need to be followed before say at least before 2 weeks, and if required any intervention should start by 2 weeks most of the time. First 4 5 days is also important regarding neonatal jaundice. So neonatal jaundice is very common in newborns. So what we need to understand is if baby is lethargic, if baby looks yellow, or if baby is not feeding well, if baby is having say inadvertently still cry, then we need to say check whether baby is having jaundice or not. And there are age specific levels for a term baby, for preterm babies, that we need to understand that certain levels we have to start with say treatment. So we have to follow within say 48 hours of discharge, within 48 hours, at times even earlier, if jaundice level warrants that. So before discharging any baby, one should be very clear that what is the current level that we can measure with say transcutaneous bilirubinometer without having say any blood level for that. So jaundice is easily manageable entity. Newborn jaundice is easily manageable entity if it is say within manageable range. If it is very high, then it can affect brain. That's why we need to take care of jaundice, neonatal jaundice, on a priority basis. So after 2 days, when we first see in first follow-up visit, we have to be very particular regarding jaundice, regarding weight loss, regarding urine output, and regarding establishment of breastfeeding. So, any questions? Hello. Can and done. Okay. Uh, so thank you very much. If you want any, you have any questions, you can ask me.